Hello, so sorry. I apologize for the glitch. We had a sudden torrential rain and the network just went off, and I've been battling to get it back. I'm completely back. And if you're still out there and you wanted to ask some questions, please feel free to ask your questions. And while I'm waiting for the questions, remember we were talking about fibroid and we mentioned three important clinically important types of fibroid. We mentioned the subserosal fibroid. This is the type of fibroid that can develop on the body of the fibroid. Then we mentioned importantly two types of fibroid which might affect your fertility and affect your pregnancy. Those two types are the types that can be seen inside the womb. Number one, it's what we call intramural fibroid. Number two is what we call submucosal fibroid. Submucosal fibroid develops on the lining of the womb, and if they get big, they can bulge into the womb and they can distort your womb and affect where the baby ordinarily will implant. Subserosal fibroid can also have an impact if they are big, but by fertility standard, I want you to be on lookout for two types: intramural and submucosal fibroid. Now, the bigger question is if you have fibroid, can you still become pregnant? Can you still be a mother? And the answer is yes, you can. Statistically, having fibroid is not a final ceiling on your ability to become pregnant. In as much as fibroid can lead to infertility, fibroid can lead to miscarriage. Some fibroids can lead to total removal of your womb through the process of hysterectomy. The ability for fibroid to cause significantly clinically important effects in your fertility is dependent on three factors. Number one, the type. Number two, the size. Number three, the symptoms. If you have a relatively big fibroid occupying a relatively big size inside your womb, giving you hell, causing a lot of pressure symptoms around the pelvic organs, then you need to think about removing them through the process of myomectomy if you still want to have your babies. So management of your fibroid is dependent on your current fertility status. If you intend to have a baby, when you have big, significantly clinically important fibroid, then you have to think about removing them. Thankfully, as you are getting older, your fibroid tends to shrink. If you have completed your family and suddenly, incidentally, they discovered you have fibroid and you're 47, personally, if you don't have any symptoms, we'll advise you to let the fibroid be. Why? Because as you're tending towards menopause, the possibility that the fibroid will shrink will be very high. Some fibroids might be a risk factor that might spiral down to miscarriage. So if the place your baby should implant is affected, assuming you have a significantly multiple big submucosal fibroid, the same place that your baby will implant will be the place they will damage. And if that happens, can you become pregnant? No. So these are important things you need to know about fibroid. And I was taking questions before the outage. Okay, so Tosi, you wanted to ask, can fibroid surgery be done without open incision? The answer is yes. Thankfully, lately, we have newer methods of addressing fibroids. So gone are the days when if we want to deal with fibroid, we go through the process of laparotomy. Laparotomy means we are going to open you up through a big incision and we bring out the fibroid. Now we can conduct fibroid surgery or fibroid removal through the process of laparoscopy. So it can be done laparoscopically, it can be done hysteroscopically, so there are a couple of newer methods we can actually use to address fibroid without necessarily breaching your body. So the answer is yes. There are newer technologies that can do that. So please, if you're joining, it's still Dr. Trudy. It's still my open clinic on YouTube. I had a problem with outage of power, but I'm back and I'm taking questions on fibroid, fertility, and pregnancy. So if you're out there and you want to ask any questions regarding your fibroid, regarding your fertility, regarding your ability to carry your baby to term, this is your opportunity. So please go ahead and ask your questions. Okay. Do you have any other question? Okay. Now, some women will have fibroid and they won't have any symptoms. Now, some will have fibroid and they will have significantly gynecologically important symptoms. Some women will feel very big pressure in their belly areas. Some women will feel bloated. Some women will have painful sex, painful menstruation, heavy bleeding, bleeding in clots. Some women can actually think they are pregnant. They might go to some places and they will give them false hopes that they are pregnant and they have carried this pregnancy for 2 years. My sister, you cannot carry your baby beyond 42 weeks. It's possible you have fibroid. Some women will have significantly big fibroid that when you see their belly, they will look like they will deliver tomorrow. What you have on the inside is not a baby, it's fibroid. The earlier you think about removing it, the better. Okay, I have another question. 3 weeks ago, your fibroid measurement is 2.5, 1.5. Should you leave it? Now, like I told you, I won't do you justice because I don't have a full clinical picture of your fibroid. Now, the question is, what type? So what type of fibroid do you have? Is it intramural? Is it submucosal? Is it subserosal? So I need to know if the type you have, it's any of these three. Now, 2.5 by 1.5, it's relatively small. But here's the deal. Most fibroids grow over time. Most women that will have small fibroid in pregnancy, the pregnancy will help the fibroid to be big because fibroid feeds on estrogen. When you become pregnant, that estrogen that will normally help to nourish your baby to be okay will be feeding the fibroid. So your fibroid tends to grow bigger during pregnancy. After pregnancy, they tend to shrink. Now, your fibroid 2.5, 1.5, if it's subserosal fibroid, not giving you symptoms, I'm going to let it be. Okay, so you need to go back to your provider and ask that important question. Is fibroid hereditary? Now, it's neither here or there, but I can tell you this. The fact is relatively common among women of African origin. The possibility that if your mother had fibroid, if your sister had fibroid, the possibility you will also have fibroid is very high. So there are some genetic hereditary components of fibroids which is poorly understood. It's still a work in progress. So the possibility that you might have exactly what your mom had in regards to gynecological challenges is very high. So there are some components of fibroid that might likely have some hereditary precedence. Okay? All right. Do you have any other question? Please keep asking your question if you join. I'm trying to shoot up maybe 15 minutes of questions before I go because previously the broadcast got interrupted, but I'm still taking questions. So if you have any question, please feel free and ask, and I'll provide you feedbacks. Okay? All right, let's count down to 10 minutes. If we don't have any question in next 1 minute, then we can go for the evening. Remember, today is the last day of May. From tomorrow, we're going to enter a brand new month, and June is my favorite month. So we're believing God to do a lot of good things in our group. If you have not subscribed, please make sure you hit the subscription button. When you're doing that, you can also join the community. We have a special community where you can interface and you can have personal interaction with me. So if you prefer that, join the community. Okay? All right. Any other question? If you have any other question, please feel free to ask before I go. Remember, our clinics is every Tuesday, 6 p.m. Eastern Time, US. 11 p.m. Nigerian. Then on Saturdays, we come a little bit early, 12 p.m. Eastern Time US, 5 p.m. Nigerian time, Tuesdays and Saturdays. Okay. Thank you for coming this evening. I hope I've helped you to understand the concept of fibroid, fertility, pregnancy. Just know this: the fact you have fibroid should not stop you from becoming pregnant and having your baby. But please make sure you consult your doctor so your doctor can tell you the type, the size, the symptoms, and treat you appropriately. It's not all fibroids that will require surgeries. Some fibroids we are going to let them be, but some fibroids will need to be removed. Can exercising shrink fibroid? Not directly. No. But definitely you need to exercise to stay healthy. Okay, so exercise can help you to avoid the risk factors that might predispose you to developing fibroid. But exercising will not shrink fibroid. Okay, very important question you asked. That's it. All right. Enjoy the rest of your evening. I'll see you again on Saturday. Until I see you, God bless you and bye-bye.